9 bad habits that are destroying your kidneys. Hello and welcome back to Healthy Care Over 50 channel. Today, we have an important topic to discuss that affects the health of a vital organ in your body, your kidneys. We often go about our daily routines without realizing the impact our habits can have on our kidneys. These bean-shaped organs play a crucial role in filtering waste from our blood, maintaining our body's fluid balance, and regulating blood pressure. However, certain daily habits can silently wreak havoc on them. In this video, we're going to dive deep into 9 common daily habits that could be damaging your kidneys without you even knowing it. It's crucial to be aware of these habits and take steps to protect your kidney health. So, the question for today is, are you unknowingly harming your kidneys? You have a choice. You can either continue with these harmful habits and risk kidney damage, or you can make informed decisions to safeguard your kidney health. The choice is yours. In the following minutes, we'll not only identify these harmful habits, but also provide you with practical tips and solutions to maintain healthy kidneys. By the end of this video, you'll have a better understanding of how to protect this vital organ. Before we kick things off, it's important to stress that this video is purely for educational purposes. If you have any health-related concerns, we strongly advise consulting with a medical professional. 1. Excessive salt consumption. Excessive salt consumption can have significant repercussions on kidney health, and these consequences are substantiated by a body of scientific evidence. High salt intake can lead to hypertension, a condition where blood pressure becomes elevated due to increased sodium levels in the bloodstream. As a result, the body retains more water to dilute the sodium concentration, placing added strain on blood vessels. This elevated blood pressure is a well-established risk factor for kidney disease, as it can harm the delicate blood vessels within the kidneys, impairing their ability to filter waste products and maintain fluid balance effectively. Furthermore, the detrimental effects of excessive sodium go beyond raising blood pressure. Excessive sodium can directly damage kidney tissues by inducing inflammation and oxidative stress. The disruption of the delicate electrolyte balance within the body, caused by high sodium levels, can hinder the kidney's capacity to regulate salt and water efficiently. Over time, this may lead to kidney tissue damage, potentially contributing to the development and progression of chronic kidney disease, CKD. Studies, including the dietary approaches to stop hypertension, trial and research published in the American Journal of Physiology Renal Physiology, have underscored the connection between high salt intake and kidney damage. Consequently, reducing salt intake is not only a prudent measure to lower blood pressure, but also a crucial step in preserving kidney health and mitigating the risk of kidney-related complications. 2. Inadequate hydration. Insufficient hydration, often overlooked in our daily routines, can lead to a cascade of adverse effects on kidney function. One significant consequence is the reduction in blood flow to the kidneys due to a decrease in overall blood volume. This diminished blood supply means that the kidneys receive less oxygen and nutrients, which can impair their ability to operate at their best. Studies, such as the one published in the Journal of the American Society of Nephrology, have provided clear evidence of this phenomenon even with mild dehydration. Furthermore, the implications of inadequate hydration extend to the kidney's vital role in removing waste and toxins from the bloodstream. When the body lacks sufficient water, waste products can become concentrated in the urine, posing a challenge for the kidneys to eliminate them effectively. This heightened concentration can potentially lead to the accumulation of toxins in the body and elevate the risk of developing kidney stones or urinary tract infections. Scientific research in the American Journal of Physiology Renal Physiology underscores the necessity of proper hydration for facilitating the kidney's waste removal process. Inadequate hydration is also strongly linked to the formation of kidney stones. When there isn't enough fluid to dilute urine, the concentration of minerals and salts in the urine rises, creating conditions conducive to the crystallization of these substances. Numerous studies, including research highlighted in the Journal of Urology, have established a compelling association between low fluid intake and an elevated risk of kidney stone development. Moreover, prolonged inadequate dehydration can potentially contribute to the onset and progression of chronic kidney disease, CKD, a condition characterized by a gradual loss of kidney function. CKD can lead to serious health complications if left untreated. Recognizing this, the National Kidney Foundation emphasizes the pivotal role of maintaining proper hydration to mitigate the risk of CKD. 3. Excessive sugar intake. Excessive sugar intake can significantly harm kidney health through various pathways. Firstly, it raises the risk of type 2 diabetes, a major contributor to kidney disease, as it damages kidney blood vessels. Secondly, high-sugar diets often lead to obesity, which strains the kidneys due to insulin resistance and inflammation. This excess body fat can even compress the kidneys physically. Additionally, excessive sugar consumption is linked to hypertension, which damages kidney blood vessels, impairing filtration. Lastly, elevated blood sugar levels lead to the formation of advanced glycation end products, AGEs, that accumulate in kidney tissues, promoting oxidative stress and inflammation, ultimately causing kidney damage and a decline in function. Reducing sugar intake is crucial for preserving kidney health and minimizing kidney-related risks. 4. Overuse of painkillers. Over-the-counter pain relievers, such as NSAIDs, are commonly turned to for pain relief, but their excessive or prolonged use can have detrimental effects on kidney function. These medications, including ibuprofen, aspirin, and naproxen, can reduce blood flow to the kidneys, compromising their vital role in filtering waste products and regulating blood pressure. Extensive research published in the New England Journal of Medicine underscores the link between NSAID use and kidney injury, emphasizing the risks associated with these medications. Another widely used pain reliever, acetaminophen, can also pose a threat to kidney health if overdosed. While its primary impact is on the liver, severe liver damage, induced by acetaminophen overdose, can indirectly affect kidney function, as documented in the Journal of Clinical and Translational Hepatology. Moreover, the prolonged use of certain painkillers has been associated with an increased risk of developing kidney disease, including chronic kidney disease, CKD. This condition, characterized by a gradual loss of kidney function over time, poses a long-term threat. 5. Smoking. Smoking, a habit notorious for its detrimental effects on overall health, takes a toll on kidney health as well. One of its adverse consequences is the reduction in blood flow to the kidneys, attributed to the constriction of blood vessels caused by smoking. This diminished blood flow impairs the kidney's crucial role in filtering waste products and regulating blood pressure, establishing a foundation for potential kidney damage over time. Scientific studies, such as those published in the American Journal of Hypertension, have effectively demonstrated the adverse effects of smoking on kidney blood flow and function. Moreover, smoking stands as a well-established risk factor for chronic kidney disease, CKD, a condition marked by a gradual loss of kidney function that can progress to end-stage renal disease. Furthermore, smoking has been associated with increased proteinuria, a condition characterized by an excess of protein in the urine. proteinuria serves as an indicator of kidney damage and can manifest as an early sign of kidney disease. As documented in the Journal of the American Society of Nephrology. 6. Excessive alcohol consumption. Excessive alcohol consumption poses significant risks to kidney health, and one of its primary consequences is the potential development of high blood pressure. Hypertension is a recognized risk factor for kidney disease, given its ability to damage the delicate blood vessels within the kidneys, thereby impairing their filtration efficiency. Moreover, alcohol's direct toxic effects on kidney tissues are a cause for concern. The metabolic breakdown of alcohol in the liver generates harmful byproducts, including acetaldehyde, which can have a detrimental impact on the kidneys themselves. In addition, alcohol's diuretic properties can lead to dehydration, which, in turn, reduces blood flow to the kidneys. This dehydration impairs the kidney's vital roles in filtering waste products and regulating electrolyte balance. Furthermore, excessive alcohol intake can electrolyte balance, impacting the kidney's ability to maintain proper fluid and electrolyte levels. Lastly, binge drinking or heavy alcohol consumption increases the risk of acute kidney injury, aka a severe and sudden deterioration of kidney function with serious consequences. The Journal of the American Medical Association has delved into the association between alcohol abuse and AKA. 7. Skipping regular exercise. Skipping regular exercise can harm your kidney health in several ways. It reduces blood flow to the kidneys, potentially leading to impaired filtration. Additionally, it can contribute to weight gain and insulin resistance, increasing the risk of diabetes and high blood pressure, both of which are detrimental to kidney function. In contrast, exercise aids in glucose control and can help prevent proteinuria, an early sign of kidney dysfunction. To promote kidney health, it's crucial to incorporate regular physical activity into your routine. 8. Ignoring urinary tract infections, UTIs. Neglecting UTIs can have grave consequences for kidney health. When UTIs are left untreated, there is a risk that the infection may ascend from the lower urinary tract to the kidneys, resulting in a more severe condition known as pyelonephritis, a kidney infection. Pyelonephritis, if not promptly addressed, can lead to substantial kidney damage, as highlighted by research in JAMA Network Open, which underscores the potential severity of kidney infections stemming from untreated UTIs. Furthermore, recurrent UTIs that go untreated or are not adequately managed can evolve into chronic kidney infections. Chronic infections have the potential to cause scarring of kidney tissues over time. This scarring can impair the kidney's ability to function optimally, potentially leading to the development of chronic kidney disease. Persistent UTIs can also contribute to conditions such as ureteral reflux, where urine flows backward from the bladder into the kidneys. Ureteral reflux can lead to hydronephrosis, characterized by kidney swelling due to urine buildup. Both ureteral reflux and hydronephrosis can negatively impact kidney function. Moreover, untreated UTIs can promote the formation of kidney stones, which have the potential to obstruct the urinary tract and damage the kidneys by blocking urine flow. 9. Excessive caffeine consumption. Excessive caffeine intake, a common modern habit, can significantly influence kidney health in several ways. One notable effect is dehydration. Caffeine's diuretic properties can lead to increased urine production, potentially causing dehydration if consumed excessively. Moreover, excessive caffeine consumption can lead to temporary spikes in blood pressure. While these increases may seem benign individually, chronic high blood pressure can pose a significant risk to kidney health. Additionally, caffeine has been associated with an increased risk of kidney stone formation. Some compounds found in caffeine, particularly oxalates, can contribute to the development of kidney stones. These stones, as discussed in the Journal of Neurology, have the potential to obstruct the urinary tract, causing pain and impairing kidney function. Furthermore, excessive caffeine intake can disrupt sleep patterns, potentially leading to chronic fatigue and stress. While not a direct kidney-related effect, poor sleep quality can indirectly impact kidney health by compromising overall well-being. In conclusion, we've covered 9 harmful habits that can silently damage your kidneys. The good news is that with a few lifestyle changes, you can safeguard these vital organs and enjoy a healthier life. So, ensure your kidneys stay healthy by making wise choices, staying well hydrated, and seeking guidance from healthcare professionals when necessary. Your body will undoubtedly thank you for it.